好，那现在时间差不多了，我们马上进行这个讲座。再一次 ，All right, once again, ladies and gentlemen, we are honored to invite our today one of the most important specialty professional, which is conducting the eye health talk. All right, ladies and gentlemen, let's welcome Dr. Hoh Hon Bing. He is currently a LASIK Cataract Eye Specialist, conducting his topic to be sharing with us.
Hey, thank you very much.
Hi,
thank you
Doctor.
very much. Nice to see you, Esmond. Yeah, thank you for inviting me to share with you our technology, which is fantastic. It's another procedure that we can use so that we can improve our lifestyle. Nowadays, there are many technology now that for medical that you can actually improve your health, improve your hair, improve your skin, improve your body, and now improve your eyesight. Now, why is it so important to talk about having good eyesight? Well, let's have a look at this. What do you think these professions have or activities have in common? There is football, there is scuba diving, and there's hockey.
Extreme activities.
Yes, they are all what we call field sports, and they are all contact sports. You cannot wear glasses to play these sports, okay?
Yeah.
So that's one actual limitation. It's actually a handicap, which means if you are growing up and want to play sports in universities and college, you really can't take part. So it's one part of the life also, deprived from you. Then the next one, these are professions. These are real professions. What do you think they have in common? You can be a pilot, you can be a soldier, or even a policeman or navy. What do you think they have in common? You have to be strong.
Accurate eyesight. Oh.
Yes, you have to be accurate eyesight.
Yeah.
You really have to pass the test because they do a medical on you to make sure you don't wear glasses. Now, you think sounds very simple, but actually this is very important because this is life and death. For these people, it's life and death. For the rest of us, it's just inconvenience. Waking up to wear contact lenses or wearing glasses, it's just inconvenience. But this is life and death. Why is it life and death? Because can you imagine, this is without glasses, that's your vision, and that's with corrected vision. Now, can you imagine you're flying the aeroplane and you lost your glasses or you lost your contact lens, or you're at war? For those people who've seen the movie Saving Private Ryan, there's a boy running on the beach shooting, and he dropped his glasses and it got broken. He died. He got shot because he can't get out. He couldn't find anybody. So these are the very important things that we take our eyesight for granted. So for those people who have glasses, who needs glasses to see, here we have a really amazing technology to help you gain sight without glasses ever again. And it's very quick. And the technology in the last 20 years has come that is now done in under 60 seconds. And it is 100% safe, which is amazing. Now, let's carry on. For those people who are here today, I'm sure you're all trying out your glasses, doing some checks to see what's your power. When you have power, this is what the chart that you will be measuring with. See, if you have astigmatism, the letters look double. If you have short-sighted, the vision looks really blurred. But if you have perfect eyesight, you can read the chart all the way down. And that's the beauty of having perfect corrected vision. Now, most of us can go to optical shop like Focus Point, which is really good. So you can wear your glasses, you can wear the contact lens, and you got back the perfect vision as someone who's born with good vision. But it's only a temporary measure. Okay, it's just temporary. You can just put it in. And what this does, it just basically corrects the rays that is not in focus, that now come in focus. So this is perfect. Most of us have been doing, our parents, our grandparents have been using glasses and contact lenses. But now, with the technology, we can make this change permanent. And this is the laser procedure that I'm going to share with you now to show you how safe, how accurate, and how fast this can be. Okay, so basically all we are doing for the laser is just basically like what glasses and contact lens do. Just change the shape of the cornea so that all your focus point, the things becomes right focus into the retina. All the light rays go focus into the retina, which is basically your nerve, which then focuses the image into your brain so that you see a sharp picture. Now, the temporary treatment is basically glasses and contact lenses. But if you do the laser, we don't even call it surgery anymore because there's no knife. It's just a procedure. It's like somehow some ladies go to have their face have a laser so that it's all smooth.
It's like a
So that you
beauty
have no-
treatment.
Like a beauty treatment. It is
Yeah.
as fast and even safer than beauty treatment because the time is less than 1 minute. For those who go for taking out pigmentation on their skin or scarring because of pimple, they take usually 30 minutes or so, and there's a burning smell. Our laser is a different type of frequency, wavelength frequency, so it's cold, so there's no pain at all, and it's that fast. I'm going to show you the video later. So there are two types. One's called the relaxed smile. It's an advantage, it's got a very small incision. The other one is a femto LASIK where you make a flap, and the whole idea is after the procedure, it changes the shape of the cornea so that all your light rays, as I showed you earlier, is now in focus into the nerve, which is called the retina of the eye. So let me share with you. This is the first one. This is femto LASIK. This is in real time. So what happens is they will make a laser, will shine onto the cornea. This is the laser on the right-hand side. The old way was using a blade. So you can see this is a blade. Now we don't anymore. We use the laser. It really is fast, and all it does is just to make a flap. And then the laser, another laser, two lasers, will then shine over it to just change the shape of the eye so that it's as if you're wearing a contact lens because it's changed, but it's permanent. And that is it. That really is about 12 to 15, 20 seconds. And that's basically femto LASIK.
Wow.
And the technology advancement is purely because there's no more blade. Blade is dangerous because it can cut, it can cause bleeding, and you can basically cut into the eye. Whereas the laser is all predefined with technology, and it's basically on at a level that you can never enter the eye. It's got a lot of safety measures. Let me show you the other one. This is the latest one. It's called Smile.
Relaxed smile.
Yeah, and Smile. It comes through a very small incision, and what it basically takes a little lump of tissue from within the cornea, similar to the contact lens. So it is a mirror image of your contact lens. So you imagine you wear a contact lens on. They're just taking a piece out that is basically the opposite, the mirror image of your contact lens, and then basically corrects the shape of your eye. So this is what we do. We just take off this. This is also less than 30 seconds. And that's it. This is basically the incision here is less than 2 millimeter. It's getting smaller and smaller. It's almost like now the general surgeon, the cancer surgeon is going into robotic surgery. The incisions are really, really tiny. No sutures, no stitches is required as well. So this is what the advancement is. Now all this advancement comes because of the technology on the computing. We need to measure a lot of data, and all the data goes inside the computer, which is made by Zeiss, and then that actually tells the laser what to shoot, how much to shoot, and where to shoot. And that's it. And the reason why it's not painful is because, unlike the skin laser, this is a cold laser as opposed to a hot laser. When those people who've gone into laser for the pigmentation, you can smell burning, right? It's like burning your flesh away. But this is not that way. It's just a cold laser just to remove that part, that's all. So these are all the many equipments. Some of them are here to measure the shape of the eye, and all this data goes inside to the machine. And this is the laser machine. This is a very, very expensive machine, and all of it is, it's all inputted inside into here, and all the data goes inside here, and basically that's how it goes. Now from start to finish, I have a video of one of the famous influencers who actually did with us, and she filmed the entire journey so that you can actually see how fast it goes. Let me share. Oh, where's the video? Last is it? Okay, here goes.
So
This is our laser center in Mid Valley Mega Mall.
This is
was
the XL View outlet.
Yes, XL View
right?
Laser Eye Center. You come in, you register. You've got to make sure you're the right person. Okay? And then after that, she's going to go through to all the different tests that I've shown you for. Every single part of the eye is measured to make sure that we get the perfect result for you. That's why it's customized. Different people will have different type of treatment. And that's why it's so perfect for you. For me, as a surgeon, My skill part, probably the input there is probably about 30%. 70% is done by the laser. That is that powerful. Okay. So we explain to them at every step. The checkup takes about an hour, 60 minutes or so. And then after that, I get to see them to make sure everything fits. Okay. Sometimes you're not happy with the first reading, you may have to come back for a second reading because this is going to basically determine your results. Yeah. This is the measurement of the retina, the nerve, to make sure everything is healthy. We measure your glasses, your old pair of glasses, and we remeasure your power again. And on the day of the procedure, we measure one more time. We have 3 consecutive readings to make sure that you have everything we can do to make sure you get a perfect result. Oh, that's me. So we take lots of different pictures. Then we tell you what to prepare, how to prepare. Don't wear your makeup before coming, shower before you come. And then to prepare, you don't actually have to take MC. A lot of people go back to work the next day. I'll show you the thing. So this is how it goes. You just stay under.
So
It's got
this
nice
is
calming
actually
light.
for...
It's very, very nice lighting. It's like a very cool lighting because everything is cool inside. Yeah, because the laser is cold.
So this is the laser of...
Actual laser is doing it now. This is now live.
Okay.
So this is the laser going through. They have a little aiming beam, and you don't hear any sound. And that's the laser. That's the laser going in on the front of the eye, shaping it. Okay.
Wow,
you can
this is
actually count.
already
This
running.
is live. This is live. Live. Actually, you count it is less than 30 seconds. Okay, it's 20 plus seconds, and that's it. Okay.
So this part is...
It's live. This is what it's doing on it. Yeah. That's it. It's done. Okay. So it really is. Then after that, I have to take out that piece of tissue, and like here, this is the part that was video, and I'm going to show it to you. This is what we did. That's the laser that we saw it just now in real time. This is the cartoon version. And then after the 20 seconds, I use this part here. It's only a 2 millimeter to go in and to take out that piece of tissue, which is the shape of the reverse shape of the contact lens. That's a very clever invention by Zeiss. Because Zeiss makes a lot of lenses, so they know lens technology very, very well. Yeah. So after it's done, you don't feel anything. They just come out. They don't even have any injections. Whereas if you do eyelid surgery, they have injections. They just go out, have a rest, and literally just stay there for about 15 minutes or so just to close your eyes and rest. But you wear your sunglasses so that you're not glared. And then you leave. You can go out. Nobody needs to help you. You can go home by Grab, or you can have someone to come and take you back. Okay? So a lot of people ask the next day, oh, when can I go back to work? When can I go to play sports? When can I do other things? Well,
Which is the recovery stage? How long was the recovery stage, right?
go back. Yeah. Go back to the thing. Yeah. So the recovery is extremely fast. Here, this. So on day 1, you can drive, right? How do I know that? Because they drive back to see me the next day. They have to come back. Yeah. I say that day they need to take a Grab to go home, or they have parents or their boyfriend or husband and wife to come
Much
and take them
better,
back.
okay.
Next day they come back by themselves and they can go shopping since it's in Mid-Valley.
Okay.
After 1 week, you can play your active sports. Okay, there's no problem because active sports there's no dirty thing.
Okay.
The only thing that you can't do for 1 month is swimming, because swimming pool may be dirty, the sea may be full of rubbish and urine and things like that. So we don't want any infection. But after 1 month, you're back. Don't need to see you again. And the good thing about this is that we never need to see you again because the safety is really 100%. And basically, you don't need to look after you after that. Okay, next slide. Yeah. So who can go in? Everybody asks who. The only criteria is that your eyes must be healthy, because that means you've never had bad infection inside. There's a scar, all right, or been hurt before. And the only other thing, you have to be over 18. That's all. Why 18? 18 is because when you are young, when you are still in high school, your power keeps changing. So we cannot do it because you're not grown completely yet. It's like your shoe size for your kids. When you buy shoes, you don't buy them the Hugo Boss or Prada shoe when they are like 15, because 16 you cannot wear already. So
might
you have to
change
wait
it.
until they're 18.
Right.
They're stable. Then that's when you can do it, and they no need to buy contact lens for them. In fact, a lot of parents ask, when's the best time? I say, after their exam, before they go overseas for their education. Because when they go overseas for education, they got problem with the contact lens and things. No, now you can really, no need, mommy and daddy no need to worry already. Just after 18, before they go to university. So that's it. I hope my sharing is useful, just to show you the technology has really improved such that it is fast, it is safe, and it's really just like what you said, it's like a cosmetic procedure. Just go in, do some eyelash rebonding or just some facial laser. It is that fast. The Zeiss technology has brought us here today. That's it. Thank you very much.
All right, once again, ladies and gentlemen, greatest thanks to Dr. Hoh, which is a very detailed sharing. And of course, any more would like to inquiries can actually check out with Dr. Hoh right here. Once again, ladies and gentlemen, greatest thanks to Dr. Hoh.
You can scan the QR code and chat with me.
Yeah, currently because Dr. Hoh is providing a very convenient way, so any friends would like to interested in more, you can kindly scan the QR and check them down.